Hi there, my name is April. I'm the foot care nurse in Lacombe and Ponoka with the Primary Care Network, Wolf Creek. And this is Jessa. She's also our foot care nurse. I'm going to say hi, Jessa.
Hi, I'm Jessa, one of the foot care nurses for Primary Care Network, and I work in Innisfail and Sylvan Lake community.
Awesome. Thanks for joining us today. Our topic today is on footwear and socks. And those are important things to know about. So we're going to hopefully teach you a few little things about those. And if you're not familiar with our Primary Care Network, we are your healthcare team in the communities of Lacombe, Ponoka, Sylvan Lake, Innisfail, Rimbey, Bentley, and Delburn. And our family physicians and healthcare professionals work together to hopefully handle all of your main healthcare needs, okay? We have a bunch of different programs like our foot care program that we have running, and if you would like to find more information about that, feel free to go to our website, wolfcreekpcn.com, and you can also ask your physician about a referral today to one of our programs. So we're going to talk about footwear here. So what to look for and how to shop for a supportive, good-fitting shoe for maybe outdoors or indoors. So how do you do that? I always tell people when you're buying shoes, it's actually best to buy your shoes later in the day when your feet are the most swollen. A lot of people have problems fitting into shoes because of that swelling, and if that's you, make sure you're buying your shoes later on in the day. And definitely if somebody is there to help you fit your shoes, that is a really good thing to take advantage of. Some stores do have somebody that can help you fit them. Some stores don't, so kind of shop around. That's okay to shop around. When you're looking for a shoe, it's actually really good if the inner sole of the shoe, the insert, can be removable, so it can accommodate a shoe insert like an orthotic, for example. We always like to recommend a shoe with laces or Velcro. That is best because you can adjust the tightness depending on the swelling day to day. And the heel cup, so the back of the shoe, I don't know if you can see me here. Can you see me, Jessa? The heel cup should be stiff, okay, when you pinch it. It shouldn't be flimsy, all right? So here, I'll try this. There we go. So take your shoe, you want to pinch it in the back. It should be fairly firm like that. It should not squeeze in because then you have no ankle support. And if you take your shoe and try to fold it in half, it shouldn't fold any more than that. If your shoe is folding right in half, then you really don't have any support, and you want to make sure your insert comes out. You can put an orthotic in there, maybe for some more arch support. So let's just continue on here. And when you're buying some shoes, make sure you walk in the store with those shoes for about 15 minutes to test the fit of the shoes. You want to walk around in them for sure, because a lot of times people get them home and realize, hey, these are not working for me at all. So wear them as much as you can before you buy them. And don't forget to clean the inside of your shoes periodically. The inner sole, you can take it out, wash and scrub it with mild soap and water. You can let it air dry. Some people use a peroxide spray and wipe things down. And if you do happen to have a new orthotic insert that's been professionally made, or even something you buy at the physiotherapist or even the drugstore, only wear it for only an hour a day and slowly increase that, so you can slowly get used to wearing that support in your shoe, because you do kind of have to learn to walk a little bit differently. Now, I don't know if any of you have a favorite shoe shop in the area. each community has different options, but of course, if you're in the city, they have lots of different options, even like Sport Check, Mark's Work Warehouse, the Running Room. They have lots of good options. And in the top hand corner of my slide here, there's a few different options, but also even PharmaSave in Lacombe. I know they have some footwear options that are, you know, good for wide feet and good for bunions, and they're breathable, lightweight, and they have Velcro. So there's lots of different options, but what works for one person isn't going to necessarily work for the next, unfortunately. And what do your favorite shoes look like? You want to have a look, because, you know, if you're having heel pain, for example, it could be from your shoes. If you have callousing on your feet, you definitely want to have a look at your shoes, because it's likely you're getting the callousing or the corns from not fitting properly into your shoes. And remember that you want to replace your shoes even if they're getting worn down on the tread, or if they have holes in the fabric or in the sole. Even if they feel comfortable to you, you still should replace them, or you might be more prone to injury. Okay. So moving on here. And you can see this picture. We have a little picture of an orthotic insert. You want a good support in your indoor shoes and outdoor shoes. And the indoor is very important. No barefoot, please. You want to support those tiny little bones that are in your foot. And you definitely, if you're wanting some better support, or if you have some structural changes, talk to your podiatrist or your orthotist who specializes in making orthotics just for you, okay? Now, Jessa is going to talk to us about socks.
Okay, thank you. So now tips for our appropriate socks. So always make sure you wear socks in shoes, as this also helps with decreasing the plantar pressure of your feet. And preferably you can wear either white or gray color or light colored socks. In this way, you can see any indications of problems, like you can see blood, pus, or any discharge in your feet. And it could either be calf or knee-high socks as well. And then next, socks provide extra protection and support for your feet, especially the arch. So it also helps to cushion these bony parts or portions of your forefoot as well as your heels. Socks reduce your chances of developing blisters or corns. Socks act as a barrier in your shoes. So for your socks, you must have smooth weave. It has to have thin or flat seams on toe areas, and as well as enough room on the toe areas as well. So it's not gonna be rubbing directly to your shoes. I mean, your feet's not rubbing directly to your shoes. The next, socks should not be restricting or leaving indents in your skin. Diabetic socks are a great option if you have any swelling. It should also be a good idea to have a sock that is non-constricting at the top band, but it's tight enough to actually stay up or at least hold it in place. And then lastly, if your feet have any moisture during the day, try a merino wool or Coolmax or Duraspan material, as they absorb moisture and help keep the skin dry. Generally, socks actually are best with cotton blend material in it. It could either be wool material, acrylic fibers, or silver, as it not just pads or protect your feet, but it also wicks off the moisture and keep your feet dry the whole day. So that's it for your socks. Thank you. Back to you, April.
So thanks for joining us today. Hopefully you learned a few quick little tips on footwear and socks, and make sure you're checking your feet every day. So have a good day. Thanks again.